CHEK Podcasts.
Hey everyone, and welcome to Political Capital, your source for all the latest in BC politics. I'm your host, Rob Shaw, from the CHEK News World Headquarters in Victoria. Thank you for joining us on a special occasion. It is episode number 100 of Political Capital. Our humble show began way back in February of 2021, a time of crisis in the province. There was the pandemic. People were stockpiling toilet paper, jockeying for their very first vaccines. It was a weird time, and we recorded in weird ways, including at home for quite some time there through electronic duct tape. Worth mentioning a big thanks to Kyle Lancaster here for tech producing this show, keeping it together each and every week. We have carried on through a new premier, new cabinet, new opposition leader, and a big thank you to you, the viewer, for watching us on CHEK, YouTube, your podcast feed, wherever you get the show. And a big thank you to our pod squad, which has evolved a bit over the years, but shows up each and every week to break down politics from the wild to the wacky in BC politics. Jeff Ferrier from Hill and Knowlton, Allie Blades from MASH Strategies, and Jillian Oliver, longtime Green strategist and longest serving panelist on the show. Jillian, you deserve an extra thank you for being here almost 2.5 years. I think you started with a baby and now you have a toddler. Is that kind of how it went?
Yeah, that's exactly right. He was, I was doing it during nap time, and now he's asking me why every other time. So big changes.
It goes by so quickly. And but, you know, it's amazing to think of how long we've been doing this. But thank you, Jillian, for being here that whole time. Down to business. Politics waits for no person or celebration. We have been talking about the healthcare crisis for months now. It's grown particularly bad in Surrey, the province's busiest ER at Surrey Memorial. Doctors, nurses, other staff going public, open letters decrying the staff shortage, the overcrowding. At one point, the veteran-most ER doctor there saying he wouldn't send his own family to the Surrey Memorial ER. And this week, the health minister, Adrian Dix, shows up with a 30-point plan to pump in more money and equipment and staff, physically expand the hospital as well. So is that enough? Is this good, solvable? Is it too little, too late? Let's go around. Jillian, as our longest serving panelist, you get to go first.
Well, I think, obviously the pressure to do something was immense. On top of all of the things you outlined, we also had the Surrey mayor trying to avoid other pressing issues like the police debacle, saying that the government should instead be focusing on the hospital. So I think, they really had to be acting. And I think, what's really great about this announcement is that they are listening to the people working in the hospital and are responsive to the, alarm bells that they're sounding. And these are good changes. I think, we'll probably see some of them extended throughout the province, and, that'll be a good thing. There's some short-term, some medium-term, long-term measures. Those will make a difference. And that's all great. I do think that it is another example of things having to get to a crisis point before we see action from the government. And there's, we saw the same thing with the cancer wait times. So while it's good that there's action, I think, often if you can have plans in place and be more proactive and get to a place where you're, putting those in before we get to these points of crises, they're a lot easier to address. So I think, it's good that this is rolling, but you got to wonder, if things could have been different if this had been put in place sooner.
Yeah, for sure. And you mentioned the minister talking to people. I think he spent 4 days there wandering around, touring the facilities, talking to folks. Jeffy produced a What We've Heard document as part of the government press release with 4 backgrounders, which I thought was interesting. It was a way to validate, maybe allow people to express feel heard at a time when they're saying that the health authority executives, for example, are trying to muzzle them, is one of the complaints we hear. You've worked with Adrian Dix in the past. Does it sort of check out that he'd spend 4 days there rolling up his sleeves and meandering around into all the different rooms and then announce a very complicated and sweeping plan like this?
I would only say he probably wasn't meandering. He was probably walking with a lot of purpose and a lot on his mind. It checks out with what I saw with Adrian Dix in health when I was there. We had a situation when I was there around paramedicine and ambulances, and folks having to wait an awful long time for ambulances to show up. And what I saw there is what I saw from the minister is what I saw here, which is direct involvement, taking ownership of the issue, meeting directly with the people involved, taking it seriously, and speaking in more than bromides, but in terms of here are specific steps that we're going to take to address the situation. Then it was about, with paramedics, it was about pay and recruitment and the structure of contracts and ambulances on the road. Here it's about more doctors and nurses. It's about making better use of facilities off-site to relieve pressure on the hospital, and some targeted help where it's needed the most. As with the paramedics, though, you're seeing an optimistic but cautious response from people in the community, people who are working. They're upset at what's happening, and deservedly so. Now the concern turns about translating the words into action, and the minister I know is very focused on that. And I have a lot of confidence in someone who's tackled some of the toughest health issues that we've faced as a province in our history. And I could, in the spirit of this being the 100th episode and not wanting to troll the opposition, I will not point out that things would have been better if Kevin Falcon had not sold the land for an additional Surrey hospital when he was in government. So I will not do that.
Right. Well, way to go on not mentioning that. Allie, the health minister said he's going to do a hospital tour all summer. Some of us are going to take holidays, and Adrian Dix is going to wander the province visiting healthcare facilities. I imagine he's going to get an earful everywhere, including rural and remote British Columbia, the north, the interior, outside of the lower mainland, and he's going to end up with a whole bunch of different requests to do things. Can we take anything away from how he's handled Surrey Memorial and the scope of this immense plan in terms of what he might be looking at and how he might be responding, and whether he even recognizes, I guess, a sort of tipping point in this healthcare crisis?
It's highly commendable that the health minister is going to take the summer to tour around and to really look at the problems all across the province, because he obviously can't do that while they're in session. There's a different role to play in the fall. What's going to be tricky here, though, is that he's promised so much for Surrey Memorial, and what then happens when he then goes on to all of these other jurisdictions, and is he going to be able to promise the same thing? So what I find very interesting, and this is completely political, I mean, Jillian makes a really good point that the alarm bells and the urgency to respond in the way that he did, and it was a masterful communications rollout, in the way that he did, was because it's Surrey, and we talk about it time and time again, that Surrey is a political battleground, that we can't have all of these issues like the education piece, the police thing, and healthcare all happen. These are all things they want to resolve before the next election. And so he comes in with answers, and the government comes in with answers right away on Surrey because it's so important to them politically. But then it'll be interesting at the end of the summer to do an analysis of what other jurisdictions he also deems as important, because they might also be political areas that they need to win in the next election too. So I find it that to be a little bit too political, but still very commendable that he would go around and take the time to do that.
Mm-hmm. Surrey is definitely, important. We talk about it again and again, and how important it is, and how the government ends up putting a lot of resources there. Let's move on to the next topic here. On our very first show, way back in February 2021, one of our topics was the overdose crisis and the lack of progress on fighting the toxic drug crisis, killing hundreds of people a month. Well, 16 months later, here we are. It is still going in entirely the wrong direction. This week, the provincial health officer and the chief coroner and the children's representative hold a press conference. They push back on critics, and they also, and this is what I want to go around on here, they talk about expanding safe supply and decriminalization into an area I'm not sure we've talked about much, which is sort of pushing out organized crime, more government safe supply on the streets, at one point, Dr. Henry proposed a future where illicit drugs like cocaine, heroin, and meth are legalized and regulated through the sort of method of cannabis, which we sell cannabis now in stores. I'm not sure we've had that conversation as the public. So let's go around on that, not just, I think, defense of the current system, but expansion idea of the current system and how we think that might go over, Jeff.
Oh, yeah, get me to talk about legalized cocaine first. Thanks a lot, Rob.
No, I'm not saying anything. I'm just saying, go really fast.
I'm saying fair. Look, that's you always expect public health experts and leaders to push the boundaries. They're doing it from a place where they see drugs on the street full of poison, killing thousands of people, and looking for solutions to try and stop the death. So that's where it's coming from, and I respect that. Government is taking a cautious and measured approach, and its focus now is on prescribed safe supply for a small subset of drugs, and that's what's being pushed out. And even that this week, wow! Here's the state of our politics on toxic drug crisis this week. You had the Conservatives, they don't like safe supply. They said, don't listen to BC's chief coroner. She's just the expert of experts on why people are dying. Leads a team of people with medical degrees, like 10 to 13 years of training. They're the ones who conduct medical examination on people who have died, drawing blood and tissue and fluids and looking at the liver and completing and interpreting toxicology reports. And by the way, she's completely independent of government, doesn't report to the premier, reports to MLAs. Don't listen to that coroner when she says there is no evidence that a prescribed safe supply of opioids is being diverted and causing increased harm and death, specifically among youth. Because the Conservative politicians, they are definitely not exploiting issues for their own electoral gain here. They are definitely not pandering and being disingenuous about these issues for votes, going after folks who just don't want to see this happening. And what's really happening here is the government is pushing drugs on children. As someone I've worked with before in politics famously said, that's horse feathers, absolute bullspit. It's made up, fabricated Alice in Wonderland stuff. And I would like for our debate on these issues to be focused on not on the vote's potential to win, but in the lives that we can save. And I'm glad that those health officials spoke out the way they did this week. It was really timely and important.
Horse spit. I have to check with the CRTC on that.
Bull spit.
I'm not sure.
Horse feathers and bull spit.
No, that's good. We can use horse spit. Just have to be very clear on how we say it. Allie, what do you think? I mean, there is a defense of not the status quo, but the existing programs, and then also a kind of future movement of drug policy here that seemed interesting.
Yeah, to expand on what Jeff was saying about the polarization and the political nature of this conversation, I just recently read this fascinating report. It's called The Two Public Health Crisis, and it was really interesting on the communications rollout of the COVID-19 pandemic and the opioid crisis. And in order to avoid the polarization and the politicization of all of this, is really to do it like we did with COVID, where there were like daily announcements, where there was information directly from the source by all of those smart people that Jeff was talking about, because then they're the ones driving the narrative, not necessarily consultants, media, and advocacy groups. Like, we knew everything about the pandemic, and we were able to develop our own opinions and make our own decisions because we got the information in real time and frequently. And then with the opioid crisis, which is also a crisis, like these are both happening at the same time, we don't do that. And so in order to remove the stigma of the opioid crisis, we need to be treating this the same way that we treated the pandemic. There's an argument about, well, the COVID-19 pandemic affected everyone, and therefore there was a wider audience that people needed to reach out to. But we are wrong in that the opioid crisis only affects the downtown east side. A lot of the drug use happens all across the province in unsuspecting areas. And so if we know this information, why aren't we talking to them too in the same way that we did with the pandemic?
80% of deaths, I believe, happen outside of the downtown east side, which was a fact that was raised in the press conference as well. Jillian, what do you think?
Yeah, I think, Dr. Henry and other public officials have been ahead of government on this all along, but I think, they had issued reports calling for decriminalization and safe supply going back, years before the government actually acted on it. So that part isn't really new, but I think that this press conference came at a time where there is this heightened criticism, especially from the federal conservatives. And it sort of, seemed like a reaction. And in fact, they said that it was, they're concerned about the increasingly polarized rhetoric because they don't want to see backsliding. We're actually only at the very beginning of implementing decriminalization and safe supply. Only 5% of people who use drugs in BC have access to safe supply. It's actually very, very limited. And that's because, as Jeff said, the governments have been very moderate in their efforts to roll it out. And in my view, I think that's actually hampered its efficacy. And I think, to Allie's point, taking more of a stronger leadership role in advocating for why these policies are necessary and why they're going to save lives is really critical at this stage to ensure that the public comes along as we implement them, especially if we do need to, like, Dr. Henry is suggesting, escalate the policies in order to save more lives, because it's clear, we're still seeing those numbers head in the wrong direction as the toxic drug supply gets even worse. So, and I think an important way to do that is to involve all parties. We saw that with the all-party committee on overdoses, which got consensus on safe supply. I think that's really critical because when we get to an election, the NDP and Green leaders who are very more vocal in their support for safe supply and decriminalization can point to that if they come under political criticism from United. But let's, continue that cross-partisan work to get experts in front of all of the MLAs and get consensus so that we can take politics out of this and get to solutions more quickly, because every month we're seeing the numbers get worse and worse, and I think people really want to see results.
All right, switching topics and on to our next topic. Boy, is it a big one, a huge issue for the province of British Columbia, the kind of thing that gets people talking at the water cooler and Coffee Row or whatever that is, the gym, everywhere. BC Ferries ending the Pacific Buffet, done, kaput. Gonski, people up in arms. We're going to break this down, get into the question of the buffet, which is the kind of thing, that people, they're talking about all the time because it is such a popular feature on BC Ferries.
Rob.
What the? Hello?
Rob. Hi.
Oh my God, it's Katie Merivale, Vice President of Wellington Advocacy and original Pod Squad member, returning for our 100th episode. Katie, how did you access this secure video link at exactly the right time?
I have spies everywhere, obviously.
Wow. I'm so glad you are here. Hello, how are you?
Me too. I'm great. Happy 100th and happy to be back.
Thank you. Thank you. Did you come here just to talk about the buffet? Is that what you want to do? You want to break it down?
I did actually, because there's something really important that we need to highlight.
Okay,
some are saying...
Let's do it, but hang on. I just want to, before you get in, I just want to say that it is so good to have you here and that we're going to talk about this buffet. We're going to dig into it right now as we speak.
Hey.
What?
Hey, am I getting left out again?
Good God Almighty. That can only be one man. McLean K, original Pod Squad member, back here live on Political Capital as well. McLean, how did you access this private video link at just this right time?
Oh, I've been accessing them all along. I never left. You just haven't called on me in like a year.
You've just been sitting there staring into the abyss for 2.5 years. Wow, thank you. It's so great to have you back here. I know you're both avid ferry users, and McLean, you have eaten your body weight at the buffet before, I am sure.
Like this morning.
This morning, that's right. Katie, what do we do with the buffet?
Well, this is a tragedy. Let's recognize that. Some are even saying that the closure of the Pacific Buffet is almost as bad or as bad as when the government of the day tried to make ferries faster. And you know what those two things have in common? Jeff's friends were in power then, and they're in power now. So over to you, Ferrier. How are you going to fix it?
Oh, Jeff, how could you?
I think that McLean can find a middle ground here for us.
Yeah.
Wow. My electroshock collar is going off like crazy right now, but be happy and who will be angry no matter what they do. Hey, everyone liked the Pacific Buffet, but whatever BC Ferries does here, they're going to make some people happy and some people very angry. And I suspect we can guess who.
That's everyone. Everyone is angry. You guys, the original Pod Squad, and Jillian, you were here as well. Did you guys think we would make it 100 episodes? Be honest here. We started out the kind of, 1 year into the pandemic. Like we hadn't even reapproved the Site C dam. We had the vaccine call center collapsing because people were clamoring to get vaccinated. It was so long ago. We were isolated in our homes. Did you guys think we were going to last this long, 100 episodes, McLean? You can be honest. I can take it.
The only way I thought we'd make it to 100 episodes is if we successfully replaced me with more insightful, wiser, funnier, and more attractive panelists, and that's why you're still doing the show today.
That's true. That is true. Katie, did you think we were going to land this long?
Of course, I have faith in you, and I have faith in the Pod Squad. So unshakable.
That's
unshakable
good.
Faith.
And Jillian, you've been here the entire ride. How has it been?
Yeah, I mean, you know what? It's flown by. Spending time with you guys is such a pleasure. It's just, blink of an eye.
Yeah,
I'm surprised. I'm surprised. I'm surprised, like I was when I was a kid when the Iron Sheik beat that jabroni Bob Backlund for the WWF title.
Okay, there you go.
I had to do a callback. Sorry, that's what I do.
Yeah. Look at how many boxes we have on the screen right now, Jeff. There's probably some sort of ancient television reference.
It's like the original Hollywood Squares. I don't know who Paul Lind is in this, but I'm having a flashback to the 70s. This is amazing.
I almost burst out laughing the moment I logged in because you guys watching can't see this, but all of our names on the screen are, McLean, Katie, Allie, Jillian, and then our ninja producer Kyle. Rob is CHEK Studio, and then of course under Jeff is the Iron Sheik. And I didn't notice that for the first couple of minutes, and I nearly spit out my tea, which I'm drinking in my political capital swag, which all of you should buy.
Nice.
Have to wait this week. Rest in peace, Sheik.
Yeah. All right. Well, I am thankful to all of you for being here for so long, and for everyone for watching, and for you guys for breaking down politics. It is, from the outside, such a complicated, difficult sort of, subject that some people just tune out, and I think to the detriment of our democracy. So I'm glad. Thank you so much for being here. Thank you, everyone, for watching. We will be back next week with all the latest here on Political Capital.